preliminary work we have done so far, and look how does it relate to nephrology, maybe a little bit, and give you some inspiration. And then I will mention a little bit about our training programs and how you guys can plug in. So as Amir said, I am a professor of medicine, surgery, anesthesiology. I direct Intelligent Clinical Care Center. I will also be program director for the new master's program, new graduate program that we are launching called AI in Biomedical and Health Sciences, Jacksonville and Gainesville. And I'm also Senior Associate Dean for Research for the College of Medicine. Let's see here. So I want to just a little bit give you background. My research is mainly in the use of computational methods and artificial intelligence in nephrology, and also in the clinical translational research. I wanted here to give you a small introduction in what we call multimodal AI in nephrology. This is one of our papers. We have another one just coming down with Dr. Shikl, me, and Tezcan, more specifically about AKI. But it brings, this idea of how you can start thinking about bringing all type of data in different formats, from what we usually use called structured data, clinical data, together with unstructured data, that would be your text, images, audio, video, that is coming in more and more into our research, and then use a large language model that are existing models trained on the biggest corpus of written human documents, and then create something like a medical foundation models that combine all of this to provide some deep contextual understanding of the health. And then you can start applying them in the different domains by tuning up what type of input data you use in terms of the structured and unstructured data. So there is a lot of application that you can think about. We summarize them for you here a little bit and provided different AI techniques that can be used for those. For nephrology education, you can think about simulated training for nephrology trainees with AI-powered environments, clinical reasoning with virtual scenarios, as example for management of AKI or CKD or dialysis complication using both natural language processing, LLMs, and mixed reality platforms and digital twins, as we are doing. For early diagnosis and prediction, probably you are more familiar with those, predicting or creating some prediction models or risk surveillance model or individual treatment effects model for either CKD, AKI, or other nephrology big diseases, using for the computational modeling of prognostication, and then for subphenotyping. Again, this would be more classic machine learning methods and deep learning for using for these, but we have more and more use of LLMs for these too. Similar for dialysis, there are already people working on predicting complications or monitoring different physiologic parameters during dialysis. For personalized medicine, think about optimizing drug dosages for patients and doing simulation-based personal medicine. And finally, for clinical trials, we can see each of these techniques before entering into the clinical trial of AI solutions, but also think about AI-aided patient recruitment strategy and developing virtual patient digital twins for simulations. More and more complex techniques. So what are digital twins? Digital twins are dynamic digital representation that mirror physical counterpart in real time and bridge the physical and digital worlds. They are linked, not only they graphically and virtually mimic physical entity, but they are also linked to real data sources from the environment, using Internet of Things and different data streams. That means that twin can be updated in real time to reflect original version or elements of the twins. Couple examples SpaceX Dragon capsule that is used to simulate safety of the capsule as opposed to physical environment. Emirates team has the virtual sailing that is used to test the design and save resources by designing sailing boats. Space Force, the US Armed Force chart digital frontier with the space twins. They are used for modeling virtual modeling of this in the space industry, and you can also see the use of digital twins for the operation management. As example, Sophie Stadium has also its digital twin that mirrors a real-time physical entity and measure or simulate a lot of operations in real time. So then when you connect a lot of digital twins, as example, you can create a metaverse. As example, if you think about if you have digital twin of the ICU, and then you have a operating room digital twins, and then you add a patient digital twin and you put in a context, as example, heart or neuro hospital, you can see how to create metaverse of entire environment or domain. And right now, a lot of technology executives are really focused on a digital twin used in large enterprise and are investing. So it's a really hot topic. In medicine, you can think about on twins in a different scales, from molecular, cellular, tissue, organ to the body scale. If you think about disease or human twins that require both data collection, modeling, simulations of the processes that underlie different organs or diseases, and then analysis, prediction, and improvement of these models in real time. So for the physical digital twins, so you can go beyond human twins or disease twins or organ twins and start thinking maybe on the next level will be modeling hospital or population level twins. So these are all examples of multi-scale, multi-model data modeling. So data is not only from different types of data, text, images, video, or audio, but it's also on a different scale level, on a molecular all the way up to the population scale. So now using all of this data, you can start creating data analytics and modeling that feeds into your digital representation of the twin. In this case, this is a hospital. And then at the top of that, you can put a layer of different applications that I use for the use cases and can simulate, interpret, or continuously monitor your twin through your twin, your physical entity. And you can use that for diagnosis, prognosis, therapy optimization, or physical planet optimization, or population health optimization. So a couple examples. Here's from the paper from National Academy introducing this model. This is an example of the idea of the real world patient, maybe with a cancer, who is now connected with its virtual model and use all kind of data flowing in the real time and monitoring through the real world wearable device to connect this virtual twin with a source model and and continuously update the health of individual through this virtual twin. And then you can also start thinking about simulation and prediction of different processes using this virtual model of the real human. And Ben Schickel has, together with me as a mentor, we have a project on a multimodal neurological foundation model development and creating neurodigit twin for neurological patient in ICU. Maybe one of his grand rounds can be around this project. And eventually think about that. You can think about using these twins for drug discovery. You have here like a patient who is simulated from many different and compared to many different patients. This is a digital twin in the center, and then you can start comparing with many different patients' parameters and see how this patient uniquely then is aligned with the specific therapies, and then you kind of precisely match that therapy, all based on a simulation parameters in the virtual twin as opposed to physical. So I'll step back and remind you that I have worked for some time with my partner, Dr. Rashidi, and 2 our labs together on developing this concept of intelligent hospital, where we use a lot of sensor data and wearable data deployed around the patient and on the patient to develop the concept of intelligent hospital that monitor patient in real time using all these advanced devices, and then integrate that knowledge in some unique insights about patients who is hospitalized in ICU. So we now want to bring that concept of intelligent hospital beyond just physical environment into the virtual hospital or virtual intelligent hospital. And this is our digital twin of intelligent hospital pilot project that was funded by the President's Strategic Initiative and being wrapped up now on 2 use cases. The one was creating virtual patient experience use case, and the second one is for the unique training opportunities for the onboarding in ICU. So the virtual intelligent ICU hospital, you can see here, starts with the physical model of the hospital that is then mapped into the virtual model and then connected with a lot of data. So our pilot project was a neuromedicine intensive care unit where we model entire ICU and operating room for neuro, and then when we are connecting with a lot of data coming from environment and also patient data on monitors that measure heart rate, oxygen saturation, as you know, everything that comes through the monitor and also through the imaging devices. So yeah, we are bringing that daily. The idea is to bring that daily in the twin and then use that to simulate either for the training purposes or for the development purposes of new AI applications. And I will show you here the current model of the virtual model of the ICU. You can see here, this is operating room in neuro ICU. This was done in collaboration with NVIDIA and Mark III company together to develop this very, very vivid and very faithful representation of the operating room. Here's the ICU. This is all 3D. This is just a video of the application in a 3D. You can actually walk through each of the room. This is a completely simulated 3D environment. So every room in ICU is virtually can be walked through, and ideally in the final execution model every single device that have any type of data will be connected here. So if you go in a drug cabinet, you can actually see what is right now in your drug cabinets and track your chain supply. Same for the rooms. In the rooms, you will be able to connect with every device and in a real time project data from that device in this virtual rendering in the room. And as example, imagine you can train in this room in a very faithful, immersive scenarios to take care of the patient in ICU. So what is really vision for our 2 use cases was, after we are done with all integration, is to simulate virtual patient experience, have a patient go through the ICU before they even come for surgery. As example, patient who is scheduled to have a surgery on his brain and be admitted to ICU afterwards would actually be able to virtually visit this environment and take a tour with our assistant. And then for our onboarding in ICU for medical students, nursing students, and other providers, we can have them through the VR be in the ICU, within the ICU walkthrough, and then have a different interaction with the coaches that are all virtual agents that we deploy within this ICU. So besides these applications, you can also think about scenario generation, where you can generate by AI scenarios of the rare cases and deploy them in this virtual environment where the trainees can then train with the VR application built on the top of this digital twin.
Hey, what is your name?
I hope you can hear this.
Hello, my name is Phil. I work here at the UF Health Shands Hospital, ICU, as a virtual medical assistant. I can help answer your questions about your kidney transplant and recovery.
Can we go to the ICU room?
Absolutely. Let's head over to the ICU room. I'm always up for a change of scenery and happy to show you around.
I have an upcoming kidney transplant surgery. Can you tell me what to expect?
Before surgery, you'll undergo tests and preparation. After surgery, you'll stay in the ICU for close monitoring, experience some pain, and begin medications to prevent rejection.
So rejection is something that I'm worried about. What kind of procedure is there if my body does reject the kidney?
Rejection is managed with special medications to suppress your immune system. If rejection happens, doctors may adjust your medications, or in rare cases, consider dialysis or another transplant.
So this was an example of one of the, so what you are seeing is actually a large language model that is being customized for certain domain and then embodied in this agent, virtual agent, or not, or assistant, who then you can talk with spontaneously. So whatever he's talking is not really scripted, it's a free speech, right? So this is LLM, where you have from the text to speech translation, you have customized knowledge for the here for this case, a little bit of nephrology or kidney transplant surgery. And then you have an avatar who mimics, who is connected with LLM and talks to you. And as we become more proficient and develop more sophisticated graphic, the avatar also has empathy, ability to project emotions. He can support you on this journey. So we are looking for the truly immersive empathy projecting visual embodied intelligence that is connected with a very large language model behind. That's what we are currently working on. So let me move from this one now on another project that we are working on, digital twin, and bringing all of this now on a population level and developing Florida digital twin, where we are connecting environmental and health data with intelligent AI modeling and simulation, bringing a lot of environmental data across the Florida, from air pollution, water, hurricane, weather, heat, everything you can think about, with the socioeconomic data related to economic characteristics of the neighborhoods, to the health data in our healthcare system, UF health system, and then we are able to really think about population level questions. As example, we can look what are the rates of AKI events at hospital following extreme heat waves, or predict long-term exposure to air pollution on incidence and progression of CKD, or look at how does air quality affect infection rates in the dialysis patient in a certain neighborhoods, and really start connecting this environmental knowledge and resilience of our environment, whether it's a natural environment or it's a built environment or it's our socioeconomic environment, to our health. And, I don't have I'm trying to be like a fast. So I want to now talk a little bit more about where I have spent quite a lot of time, and it's how do we prepare our physicians and trainees for the new fourth revolution with the AI, especially with the generative AI and the large language model, and perhaps general artificial intelligence that is kind of projected to come in the next 5 to 10 years. I think there are a lot of challenges there, and we really need to reimagine medical education, and not only medication for those who are in our pre-graduate medical school or pre-med school pipeline, but also think about existing workforce that we have and how does that fit in this new environment in which there will be increasing demand of physicians to know AI, to understand AI application, to deploy AI application, and also evaluate them and eventually improve them, because we need to move from the passive user role to really active solution creators with these tools that are incredibly powerful. So with that in mind, I have been working now for almost 3 years on this idea of a full stack education, where we go from literacy to mastery for AI for health. And we are expanding even this cycle, and I'll talk a little bit more about that, because this cycle is mainly focused on our pipeline for medical students through the residents, fellow, practicing physicians, right? And starts with a really literacy training with either boot camp, with a combination of our AI passport program and AI boot camps with graduate program and so on. So some of you have heard about our AI boot camps that we offer for incoming medical students and graduate students. They are 2-day in-person intensive foundation of AI applications, clinical care. Dr. Schickel leads them for our office, and he provides them 1 or 2 times a year. But we wanted to create a more structured program that will be focused on both healthcare providers, but also on those who want to gear that towards research and solution developments for AI in health. And we were lucky to get funded by NIH for AI Passport for Biomedical and Clinical Research Program that complements our AI Passport for Health that we developed with funding from the President's Strategic Initiative. The passport, Dr. Schickel is MPI with me on this grant, together Dr. Yulia Strekalova, another of my mentees who is in a public health, School of Public Health. And this program delivers literacy training for allow you to get your passport for AI land through the structured 16 weeks program that 12 weeks are dedicated to 2 weeks blocks of 6 modules that cover entire really AI for health domain, from foundation, ethics, imaging, data, predictive modeling, and large language and generative AI, and culminate with a 4 weeks impact project that is delivered through the mini hackathons. And it's really holistically focused on a person who enters the program to come and reflect with their own problem. It is designed using our experiential learning framework, where you see the problem through the series of very mission focused or domain focused videos. Then you interact with the knowledge with a series of assignments delivered through the set of workbooks or notebooks that you can use. With no coding background, you can actually create AI solutions. They are low code or no code AI tools. You're going to be proficient with them. And then after you practice, you practice, then you reflect. You do a reflection exercise where you actually bring whatever you have just learned in that module to your own question, your own domain, and then you kind of close that up through interactions with your peers in both community synchronized activities that we through the community calls. These are weekly calls that you meet with your peers and your coaches, and you can really kind of integrate that knowledge that you have done through these 2 weeks, and you also do engage in peer-to-peer feedback through your assignments. So through that cycle of 2 weeks, you do like a very intense 5 to 6 hours upskilling for 12 weeks. And then at the end, you pick up your mentor and coach, and you develop a small competition project where you bring whatever you are interested in, problem you want to compete with, and you finish in this 4 weeks course that also gives you some idea how to prepare for competition, how to structure a small project, and how to deliver that. So our first cycle of the full AI passport will be launched on January 12th. We will be opening up for the community across not only University of Florida, but entire Florida and nation. This is nationwide program. We will offer 6, you will be able to pick up any module you want. You don't have to do them in succession. Every 2 weeks, each of the module will be offered. So you can just kind of pick and choose, like from the menu, what do you want to do at that time? You can go back to modules if you think you finished too quickly one, and go back to another one, retake it. But once you finish all of them and you complete the program, you will also be able to get a certificate from the University of Florida for AI for Health. So this is all going to be in January 12 launch for our first pilot. Please use this opportunity. I will work very closely with Martina, our Dr. Murphy, who is our Senior Associate Dean for Graduate Medical Education, to promote this program among residents and fellows. This is a great introduction. In the fall, when we launch our first in the Florida graduate program for AI for biomedical and health sciences. There are 41 AI graduate programs in the state of Florida, and none of them was before designed for biomedical and health sciences. Our program will be first of its kind, physically located for the physical campus in Jacksonville and the virtual campus everywhere in the world and in Gainesville. It will be a fantastic opportunity also for those who are interested in pursuing either entrepreneurship or research or even leadership in AI, in a medicine, to take this course, because wherever you go in your next career, you will need to lead in digital transformation of medicine. So I highly recommend you both passport program and graduate programs. If you want to learn more, I will have a QR code at the end you can scan, and you can also reach out to my team in both IC3 Center, Prisma Peak. This is a good opportunity to tell a little bit about Intelligent Clinical Care Center. It's located in the Malakowski Hall on the second floor, really focused on developing clinical and research applications for AI, for health, developing next generation of AI researchers, and really leading with this in this domain in our nation and the state. We have a Catalyst, AI Catalyst program for the Catalyst grant, where you can apply in a partnership with AI faculty to get pilot funding for the AI grants that are all obviously very translational and applicable for any clinical problem you can think about. We have a very vibrant membership from across the university, from AI faculty and clinical faculty. You can also apply to become either full member or associate members and use some of our resources. We have a great series of multidisciplinary talks. Several of our faculty are member, Dr. Pinaki, who is an expert in digital AI pathology, really national leader in this field on a kidney precision medicine project. He is a great resource for both translational projects, but also for mentoring, and also anyone who is interested in K awards would be a fantastic mentor. Dr. Schickel is another assistant professor who is involved in an Intelligent Clinical Care Center with other AI faculty, but he's a member of Nephrology Division. Then Dr. Wei Shao, another member of the Nephrology Division, who is assistant professor in AI with expertise in imaging. He is also a great potential collaborator for junior faculty who is interested in entering these partnerships and writing grants or creating implementation projects or simply innovating our clinical care. Also, not to forget, Dr. Tejjan Bashlanta is our research associate professor. She is also in nephrology, and she is also a member of Intelligent Clinical Care Center. My own lab, Prisma P, is working currently on several projects. If any of these are like kind of inciting you, please reach out to me. We are working on autonomous delirium monitoring and adaptive prevention project. Intelligent ICU, you heard a little bit about that. Digital twins clearly might be of interest. Jacksonville and Florida digital twin for population health. Our surgical risk assessment through our Idealist grant. MENT AKI is our drug-associated AKI grant with the University of Pittsburgh. AI Passport is our grant of the development of AI Passport program, and exposome database is something we've been working on, creating environmental data set that you can ask population level question and explore how certain diseases, kidney as example, can be thought about in connection with the environment. So that's all I have for today. I would like actually to really take your questions and not bore you with my boring lecture. This is the QR code for the AI Passport program, and then you can reach out to me through email on the social media. That's all I have for today, and would love to hear questions from our fellows or residents or even our candidates. You can ask anything about AI or research at the College of Medicine.
Perfect. Thank you so very much, Dr. Bihorac. As always, it was very interesting and really futuristic, I would say. So for the first year fellows and also for the candidates that might not, first year fellows were not there at the beginning, but I think that what the block that says UF Nephrology Fellows, it should be them. at this point. I just want to make sure they know that Dr. Bihorac is a former fellow of our program as well. So she did 2 years of 2 or 3 years actually of nephrology fellowship, and then she did critical care medicine, and then started with AKI research. But over time, obviously, AI came on, and then she shifted her research into AI and is an international leader in AI. I get to see her a few times a year in different meetings that we have in common, and I have learned about it quite a bit because of her talks, actually. Azra, the passport for AI part, if I remember well, there was a pilot program for that you had a few people go through. Is that the one?
Yes, we were. So the full program is a 6 modules and impact project. Will launch in January. But as we were developing modules, we piloted several modules on its own, right? Just one module.
Yeah.
And we had a great, turnout. We have up to 120 people signed for a module. It's a really very popular, and we will have a full capacity to accommodate as many people we want. The program is meant to be national, international, if you want, hopefully. And it's a great place, in this community call, you can connect with people from different backgrounds, from different universities, and get to learn and create teams and start thinking about medicine a different way through the lens of AI.
Yeah, so actually I have to make some kind of announcement for you that I actually was part of that pilot program, and I have to say it was fantastic. You do it on your own time, so you just can do it on your weekends, on your night, whenever you like it. You can go back and look at them several times, and they're very useful, very, very practical. They don't tell you the things that you need to know for a certain level of AI literature. Just starting from the basics. And I suggest, remember everyone what is said, and Dr. Bihorac mentioned it in a different way, that AI will not replace us, but doctors who know AI will replace us if we don't know AI. So AI is here to stay. The better we know it, the better our life will be. I don't know if there are any questions for Dr. Bihorac. As she said, it doesn't have to be about her presentation. Anything AI in the College of Medicine is led by Dr. Bihorac, actually. Perfect. I think you have been very clear, Azra, in your presentation. And thank you so very much, everyone, for being here. The fellows, the faculty, the candidates, and thanks again, Dr. Bihorac, for an excellent presentation. I hope everyone will have an excellent weekend. Thank you.
Thanks. Bye-bye. Take care.
Bye.